Appreciate everybody for tuning in to the Bob Squad Medical for All Town Hall with my friend here, Bobby Bliatout. First of all, in case those out there who doesn't know who Mr. Bliatout is, he's the executive of an FQHC, which is a federal qualified healthcare centers, which is nonprofit clinics that I need to take this. Nonprofit healthcare centers that are through Bakersfield all the way down to Sacramento. So he has hundreds of employees under his employ. This is a smart guy. I've known Bobby for a while. There's a number of things here that we want to discuss today when it's dealing with Medicare for All. But first of all, Bobby will be running in the 22nd Congressional District, which is Devin Nuñez's district, for all those who are unaware of that. So the idea here is we're going to ask questions, and in order to do that, we're first going to we want everybody to email their questions to bobsquad2020 at gmail, which is BOBSQUAD 2020 at gmail. And you can ask Bobby any questions about Medicare for All. We'll try to get to as many as we can while we're on the air. Also, share this. This is something unique that Bobby's doing, so he can reach out to all those that are out there that are interested in some of these important questions. Okay, so if you're watching this live now, go ahead and do watch party. Share it as much as you can. If you've seen this, it's already past the live event, go ahead and just share it so people can, you can direct people to this important information that Bobby's doing for us today. So we have a special guest today. So we actually, we have Bobby here, and we have a Dr. Bill Honigman, who is from Orange County. Dr. Honigman is an emergency room physician, recently retired after practicing for over 35 years in Orange County, California. He has been active in politics since his youth. He is currently an organizer for the grassroots group Progressive Democrats of America, acting as California State Coordinator and Orange County Chapter Leader, and is a coordinator of the PDA's National Healthcare and Human Rights Issue Organizing Team. So Dr. Bill is a longtime Democratic Party activist, including as delegate to 2 previous Democratic National Conventions, a former Democratic Club president, current county central committee member, and a California Democratic Party delegate, and serves as the Southern California vice chair of the senior caucus of the CDP. He's also a member of the steering committee for physicians for the National Health Care Program of California. Dr. Bill is a strong believer in health care as human right and as an advocate for a single-payer expanded and improved Medicare for All system. So we got a couple professionals here in the healthcare field. So I'm going in. I'm going to ask first question. That's okay. All right. I want to go in the weeds here. So why did you decide to do a format? Because this is unusual. We don't normally do formats like this. I don't see politicians doing stuff like this. So why the Bob Squad? Explain that.
Right. So I decided to create, with our campaign team, we decided to create a format in which we are going to be able to talk with the constituents, talk with the folks that are out there. And it gets expensive to get big town halls or convention centers. And, we are in a great age of technology, and we can use the internet. We can do this. And this is our very first one. This is our first Bob Squad. Right, we're out here on the Bob Squad, and it's a time for you to ask questions. It's a time for everyone to find out what I'm about, what my platforms are, and how we're going to address the issues that are plaguing our nation. I mean, right now, for today, we're going to talk about Medicare for All. I mean, we are one of the richest nations on the planet. We are. And it makes no sense that we have millions of people who don't have access to health care. And we don't provide them with the insurance that's necessary, right? And so we are having a health care crisis right now. And it's going to take experts. It's going to take people who understand things that are going on, right? And so if you look at it today, we have problems with the ACA. The administration right now is trying to make it unconstitutional, and it almost looks as if they're going to be successful. So what we're going to have to do is to be able to stop their progression, be able to put a plan in place in case they do make it unconstitutional. And I'm scared and fearful of what happens if it becomes unconstitutional. Because what we're looking at here is, like 30 million people being uninsured. That's not good. We're looking at pre-existing conditions no longer being protected. So people like me, you're looking at for me to have because of my pre-existing conditions and things that are in my family, you're looking at around $15,000 to $20,000 a month premiums or bills. We're not going to have insurance at that particular point. So we have to make sure that everyone's insured. And so the best thing to do is to, right now, go after the only bill that's really on the table, which is Medicare for all. And to help us do this, in Bob's squad, I'll have panelists and experts also along. And so today we also have Dr. Bill Honigman. Dr. Bill is what he likes to go by. And he's here right now. He's joined in. Hey, Dr. Bill.
Hey.
All right.
Thank you.
Anything to say there?
Oh, well, thank you so much, Bobby and Steve. Thanks for having this venue to speak out and to discuss the important issues of the day. I'm especially grateful, Bobby, that you're running for office and you're stepping up. We say, those of us in the progressive movement say that candidates more likely have a chance to win when they run strong on our issues. And healthcare polls incredibly high. In fact, Medicare for all, the whole concept of it, polls something like 70% across the nation. So it's very much on people's mind. And really, we're not talking traditional, center-right, center-left politics. I would say this is not about left versus right, or right versus left. This is about right versus wrong. So, it's where Trump voters have something in common with non-Trump voters. We all want things like clean air, clean water, an education that's a stepping point for our kids. They can do well in the future. And we all want health care for our family, our friends, co-workers, neighbors, fellow citizens. So it's extremely important that we talk about this in terms of next steps. We know that, as you said, the Affordable Care Act is being threatened all the time. The fellow who currently holds the office that you're seeking, along with his various buddies like Paul Ryan and Kevin McCarthy, proposed to repeal and replace the Affordable Care Act, or Obamacare. Of course, they had no replacement for it whatsoever. So they tried to repeal it. That didn't work due to the famous thumbs down vote of John McCain in the Senate. And a lot of us worked to make that happen. If they were to repeal Obamacare, like you said, if the courts were to nullify or find it unconstitutional, really the only replacement that makes sense is Medicare for all. And that's because we know it saves money and saves lives. There's models all around the world that shows that when you eliminate those third parties, like private health insurance, which is really, I like to call it corporate run, market-based insurance, as opposed to a we the people insurance, which is what Medicare is, and it works well for seniors. Can work better. We need to improve Medicare. But when we replace it with that, then that's real change. That's real progress in healthcare. So we like Medicare, and we want it for all. And that concept is incredibly popular. So I really thank you for bringing the issue forward today in your first town hall, Bob's Quad, which I'm happy to participate in.
Thank you. I'm very happy that you're able to participate with this as well, so that our folks can get a perception of Medicare for all and what it is. I think we've discussed before that what we want to get out of here of this town hall is to be able to dispel a lot of the myths that are out there. And, we are opening up rather than just kind of talking to the folks out there. We've welcomed questions. I think Steve said before, go ahead and email bobsquad2020@gmail.com and we'll ask those questions, those questions asked.
Yeah, so Dr. Bill, I want to ask a question. I'm being kind of greedy and just going to, how, progressives have this unique way of wanting to attack the president first, where we don't want, that's not how we want to approach this. We want to approach it in a way that we can attack the issue in itself, which is Medicare for all. That's the most detrimental thing that we need to do. What do you think is the best way, in your opinion, the best way you think we can do that?
Well, I think, that's a great question. And frankly, I think it's a mistake. It's a trap to look at this as linear, center right, center left, left versus right. It's really right versus wrong. And that's what makes politics a big tent rather than, some linear thing that you can try and triangulate, be a little bit to one side or a little bit to the other. It's not honest. It's not sincere. So progressives, in general, I think want to take our case to the nation. We want, folks like Bernie Sanders talks about Medicare for all at every opportunity. He's basically taking the case to the people. And that doesn't have anything to do with process and personality. It's all about policy. And when we stick to policy and not get mired down in the the politics of personality and process, we just stick to policy, then I think we find common ground, we find agreement. So right now, too many people are falling through the cracks, as Bobby says. It turns out, and this is science. This is not made up. This is science. So some people don't believe in science. I believe the climate is an emergency. We're in a climate crisis because the scientists tell us so. We all feel that that summers are getting hotter, and especially there in the valley, that's a really tough thing. And water shortages here in California, fires, etc. But we know that science tells us this, and not just how we feel when we go outside. That's really weather, right? Not climate. So the same thing is true in healthcare. The science has been done, and for many years now, it's been known that eliminating those third-party payers and getting some control by bulk purchasing pharmaceuticals, over the cost, is what allows people to have more health care for less. It's going to cost us less money and get us more health care. And that's what ought to drive the discussion. I didn't mention Donald Trump in any of that.
So, you actually just did right now.
It's not about personality. It's about policy.
Yeah. So I'm going to bring that to you, Bobby. You're running in a very highly contested district. District 22 is going to be a tough one. Okay, Devin Nunes is bringing a lot of out-of-state money into his campaign, and you're a grassroots guy. Okay, you're a trenches guy. So this question is going to go to you as well. How do we attack this Medicare for all situation that we have? Because this is a problem. So how do we attack that issue on the Medicare for all without necessarily attacking Trump and turning away some of his voters? How do we do that?
Right. I think a big part of it is the education. A big part of it is being able to get out in front of the communities and be able to talk about this. And that's exactly how we're going to be addressing this with these town halls, these things that we do to educate our folks. We can get viewers now. People can share it. Please, people, share it so other people can see it. Money for the campaign isn't everything. People have to trust the politicians. People have to be able to trust the representatives. And right now when we look in Congress, we have less than 5%, I believe, of Congress has any experience in healthcare.
Yeah.
And so as we are addressing a healthcare crisis, how are they going to be able to address the negative impacts that the opposers are bringing in.
Right.
You know what? Most of America want health care for everybody. Most of America believe in a single payer system. Okay, they want a universal health care system. And then you face all these things like Dr. Bill brought up, where this, oh, you're not going to be able to keep your own health insurance, or you're not going to be able to keep your doctor. All of these things are myths. And we have to be able to educate everybody out there on what these things are. So grassroots, I'll be out there. I'll be talking with folks. I will be 100% supporting Medicare for all, but actually being able to understand it, to have a good conversation with the folks, to explain to them exactly how it will work. Because most of these people who oppose it haven't even read the bill.
Yeah.
And
I notice when we talk on a national level about Medicare for all, you see this in almost all the town halls, is when you talk about it nationally, people disagree, right? When you talk about it just the way you did, at a local level, at a personal level, where my friend is sick or my aunt is sick, then almost everybody agrees. So I know we got our first question, because this kind of gets to what I was trying to get to. So our first question is, the Democrats can't agree to Medicare for all. How do you expect to accomplish this?
Right.
And thank you, Jim, for that question.
And yeah, thank you, Jim. That's a good question. I think we just kind of hit it there. What we have in Congress are a lot of individuals who want to find a solution to our healthcare crisis right now. And the solution always goes to either economic or something that is party politics, like Dr. Bill talked about. Look, diabetes doesn't care if you are Republican or Democrat. Cancer doesn't care about your party affiliation. We need to address the policies. And how do you address the policies when you don't know what's being written in them?
Right.
You can't understand it.
Right.
And so we need to be able to add more of that to Congress. And that's what I want to be able to do, so that when my colleagues in Congress, the fellow congressional members, when they have a question, I can answer it for them. We don't have to wait for a committee, for all these other things to happen, and we have to wait for them, because that takes too long. I'll bring them all to the room. We'll talk. I don't care what party you're on, right? What party you're a part of. I will address these things, and we're going to look at it. And when you look at Medicare for all from a, like a social, humane aspect, it's the right thing to do.
Right.
When you look at it with economics, it's the right thing to do. And I'll be able to explain that to folks.
So I'm going to actually extend this question as well to Dr. Bill. We have Dr. Bill. So Dr. Bill,
Yep.
You were in the trenches as well. I mean, but you were you worked in the medical field, within the medical field, right? So you know this at a personal level. There
Yeah.
are so many different avenues with what you see in those trenches, and how do we accomplish all of these different mandates and certain, we have presidential candidates right now that view something a certain, like Elizabeth Warren's Medicare for All program in comparison to Bernie Sanders. So even within the progressives, we do differentiate a little bit. But what do you think is a good approach? Just seeing from what you see at a doctor level.
Yeah, so I think, you hear these incredible stories, and really this issue touches all of us, either personally or people that we know. Everybody knows somebody who's had a healthcare struggle because of accidents, because of costs. And, these could be hidden costs that you have, like, say, if you have to see an out-of-network doctor, you get admitted to a hospital and have surgery, and everything's all paid for except the anesthesiologist. Apparently, they had to use somebody that was out of network. Who do they go to pay that bill? The patient. Stick the patient with that bill that can be, thousands or tens of thousands of dollars just for one, appendix surgery. So I think we can all connect on that level. And like we were saying, Bobby pointed out that we still have far too many people with no insurance. And part of the science shows that for every million people with no insurance, 1,000 people die, preventable deaths every year, which means, the clock is ticking. You or I or anyone may make the wrong choice. You're sitting at home thinking, boy, I got this bad toothache. It's getting worse. I need to see a dentist. I know this is going to cost me hundreds of dollars, which I don't have. You're putting that off. And then finally you end up in my emergency room in the middle of the night with a dental infection, because you put it off. And that dental infection can become a life-threatening, sepsis that can, you can end up in intensive care because you put off seeing a dentist. Now that is so incredibly common. I can't tell you. I think it was most nights that I was in the emergency on duty. I would see nowadays, most recently, I would see people with an untreated dental infection. I mean, there's a whole section of Tijuana that people go to, for dental treatment because it costs half or even less than that of what it costs, just over the border here in the United States. I think they call it Molar City. The people are going to in Tijuana to get dental care. So that's unacceptable. Like Bobby says, we're the richest nation in the world, and why can't we provide health care like every other civilized country does around the world? We're not a civilized country if we don't provide health care. So I think that message resonates with people across the country. I mean, right now, 70% of people like the idea of Medicare for all. 85% of Democrats. So they answer Jim's question about how do we get Democrats together. Right now, 85% of Democrats are in support of the idea of Medicare. 52% of Republicans are in support of the idea. So it's incredibly popular. It's getting more so as we educate more and more people like Bobby says. And it's going to happen. It's just a question of time. And who's going to die still, before we get it done.
Awesome.
Right.
Awesome.
And I think one big thing is that, remember, these are Americans. These are voters. Those numbers don't absolutely reflect those that are in Congress. And so as we get there, as we elect new people in there, people have to have the strength to be able to push forward with what has to be done. Right? And when you know what to do, you can stand by your strength. And I think a lot of new folks will get in. And when the new folks get in, they stick by what they say, right? And I will tell you that I'm going to stick by this. I will continue to fight for Medicare for all. I believe we need to take care of everybody.
Awesome. Okay, so let's move on. We're going to go on to another question. So, all right. So Jesus says, will Medicare for all force the closure of rural hospitals? Yeah, that's actually a really good question. That comes up all the time.
And no, I laugh at that because that's something that I've been hearing over and over about this Medicare for All bill, especially after they asked the question at the presidential debates. They say, oh, the rural hospital can't live off of Medicaid and Medicare. And they can. In fact, a lot of the biggest expenses in these rural hospitals are uninsured people. People who come in, have to get their care, and they come in to take care of the flu, they come in to take care of, they're dehydrated, or they have the toothache, like he said, they may run into sepsis, and becomes very, very expensive care. Right? And they, in that sense, are covered because we must provide that care to them regardless if they have documents or not. Right? Regardless if they're Republican or Democrat.
Right.
They're still going to get taken care of.
Right.
And so when they go in, when they can't pay their bill, that cost gets passed on to the taxpayer, gets passed on to the person who has private insurance. So we are still paying for it.
Right.
Right? And so if you told those rural hospitals, the real question is, if everyone who came in was covered, would you still be on operation? And they would be.
Right.
And Dr. Bill?
And I kind of want to extend on that. In a lot of these rural areas, I know my wife is a nurse practitioner in one of these rural areas, in one of these rural communities, and you're right. Most of their patients are on Medicare.
Right.
They're on some type of governmental health care program. So, yeah, I understand that's a big fear for a lot of people, and you clarified that. Dr. Bill, I guess I guess we could just ask you the same question. I mean,
Sure.
will rural hospitals close down if
No.
we have a Medicare
In fact,
for All program?
Yeah, they're closing down now. So, Medicare for All will keep them from closing down, okay? Because, it's not in control of a private corporate boardroom anymore. It's in control of we the people. Okay,
Yeah.
so if we the people designate it as a priority, we can make that happen. And I give you the best example of that I know of is the movement that led to Medicare for All in Canada. You know what they call their system in Canada?
What's that?
Medicare. Okay, so they call it Medicare too, and it's for all. So it really is Medicare for All in Canada. So that started in the 1930s during the Depression. There was a prairie preacher, okay, in rural, Saskatchewan. It's a rural state, lots of farms, farm workers, union folks, working folks in Saskatchewan. That's where it started. And they said, we can't get to doctors. We can't get to all the resources that we need, when someone is having a baby, for example. Are you going to have to drive hours to get to deliver your baby? No, it's going to happen in the car, and that's dangerous, right? So that's where it happened. There was a fellow up there, a prairie preacher named Tommy Douglas, who started the movement in Canada. And he said during the Depression, it wasn't right that people would die because they couldn't afford to see a doctor. So for years, decades, he worked on that movement in Saskatchewan. And that was the first province in Canada that went for Medicare and had their own system of insurance and payment. And that's because the people made those decisions, not some private entities, like say based on market share. So this is very typical in America now, where we have, especially in inner cities and rural areas, we have very few resources, and all the resources are going to the higher market share areas. So what we need to do is take this out of the hands of entrepreneurs and put it in the hands of we the people, where we can make those decisions by electing good people like Bobby off. So
Thank you.
That's not an easy thing to do. But once we do that, then we save rural hospitals, and we put those priorities where we know they're needed, as opposed to someone else making that decision.
And let me add on to that too. When you look at here in the Central Valley, in our district right here, we have a huge migrant population. And in the system that we have right now, when the counties are in control of this and deciding who has to flip the bill, who has to pay for the bill, it prevents a lot of our migrant workers, even American citizen migrant workers, from being able to get the health care that they need. So moving to a Medicare for All system is going to be able to allow them to get their primary care and their emergency care. And when they get their primary care, it's going to lessen the amount of emergency care that they need. Right. So then our driving force of agriculture here, our workers will be healthier, and our workers will be able to move on forward in life easier if we have a Medicare for All system.
Okay, so if everybody's just tuning in, and real quick, we're here at the Bob Squad Medical for All Town Hall here with Bobby Bliatout, who's running for the District 22. And if you guys have any questions, we're on live right now, so you can email your questions to Bob Squad, BOBSQUAD 2020 at Gmail. We'll try to, put your questions on the air. So what do we got next? So how are you going to prevent death panels if Medicare for All is instituted? Melissa, thank you for this question. Look, I'm not, no disrespect to Melissa's question. I mean, that's a serious fear. But Bobby, can you answer the death panel question?
I'll give my opinion on what it is, because I know there's a lot of different opinions on it. But there was a fear when the ACA was actually coming through place, and then they passed it on to Medicare for All. But basically that if the government was going to be in control of healthcare for everybody, that they're going to probably want people to die because it's cheaper, and just be moving forward for that. That's not true. In fact, being able to do something like Medicare for all, which is what would be the most efficient if you kept people healthy. And we're looking at preventative health medicine. We're looking at all kinds of different steps that include things that are beyond just medical care from a doctor. We start to look at things like their environment. Do they have enough food? Do they have affordable housing? There's all these other different steps that affect healthcare. I mean, gang violence. Look at gang violence. That brings up the cost for healthcare, right? So any kind of efforts that we can put into the environmental issue of a human being is going to also save on healthcare. So it's not about making sure people die, or it's about making sure that people can live, and doing it in the most humane and economically efficient way possible. So I don't believe there'll be any kind of talk of anything around death panels. That was just a complete fear tactic that people had.
It was very effective, though.
Well, that's what people would think.
During the ACA days.
Right. And I think we kind of took care of that. And I think as we get closer to for a Medicare for All bill being voted on and passed, I know they'll bring that up again. So Melissa, thank you for letting us address that and looking at that. But the truth is, death panels are a joke.
And Dr. Bill, you being in the medical profession, I know you're retired now, but was this a question that's been approached to you and to your colleagues?
Absolutely, and thanks for asking, Steve, from that perspective. And Melissa, it really is a good point. Is who makes those decisions? You know, who is it? Who should it be? I mean, should it be you and your doctor? Should it be you, your doctor, and your insurance company? Should it be you, your doctor, and the government? Right. So the question really is who do you trust? You know, do you trust your doctor? A lot of us don't. I mean, that's why we are so malpractice suit happy in this country. We just have way too many lawsuits against doctors. I mean, the only person that a doctor hates worse than a politician or an insurance agent is a lawyer, because they're going after them, you know, way too often. So we need to have that patient-physician relationship and that trust back again. In Japan, I'll give you as an example, they have universal health care with a single-payer system. They do have some supplemental private plans. You can, you know, it's more like concierge medicine. You can get a fancier room in the hospital or something like that as a supplemental insurance. But really, you could pay cash for that anyhow. But in Japan, on average, first of all, they live longer than we do. The Japanese live a full 5, maybe 7 years life expectancy, longer than we have in this country. They have more old people than we do. You might think that it would cost them so much more to take care of all their old people. But the really astounding fact, this is fact again, not fiction, is in Japan, they see their doctors on average 13 times a year compared to our 4 times a year.
Wow.
Okay? So 3 to 4 times more on average they see their doctor. If you're an old person or you're somebody with a bad medical condition, you know, you might need to see your doctor once a week even. And you can do that in Japan. You cannot do that here in this country. We are being rationed down to 4 visits a year compared to their 13 visits a year. And that is a death panel. And we're being told by insurance companies that we can't see our doctors more. You can't trust a doctor. You can't have a reasonable end-of-life discussion with your doctor at only 4 visits a year, or 2 or 1, like some insurances say. So really, that's why the decision has to be in the hands of we the people, where we can make medical decisions on payment, at least, to doctors and hospitals. We can pay them based on evidence-based best practices, and have, you know, review boards and that kind of thing to say, is this a legitimate treatment or not? And Medicare does an excellent job of that now. It could be better. We need to improve Medicare, but it does, a great thing. If we expanded Medicare that we have now to everyone, our life expectancy would go up. You could see your doctor more, today, if we did that today. So really, Medicare for All will get rid of the private death panels that we have now from big insurance.
On the question, I'm sorry to interrupt you,
by the way.
but on
No, please,
I always
go ahead.
find the death panel question kind of interesting, only because this is no disrespect to people that believe it or think in this way, but you think you have a for-profit system that helps the profit aspect of insurance, and then you have a governmental system that is detrimental to the welfare of citizens. I always find those two questions, if you have a for-profit insurance company, the whole idea of a for-profit insurance company is to make profit. So to me, it would be more in the way of the death panels would be more in the for-profit system than it would be in the private sector or
right.
in the governmental sector. That's just my opinion.
Well, you are kind of right.
Okay.
It's like how Dr. Bill is also saying it, that how the death panels in a way exist today.
Yeah.
When you look at this though, the practices that they have that are moved forward for like advanced directives, the thing that they have put into place, saying making sure everybody has an advanced directive because we don't want to waste all those expensive hospital bills. It is the private insurances that are, asking doctors and asking people to say, hey, take care of this with your patients, rather than saying, hey, take care of your patients.
Yeah.
You see?
Yeah.
And that's coming from the private insurances because it's cheaper to ask people to fill out a piece of form, advanced directive form, than it is for them in their mindset to see the patient.
That's interesting. Okay, so let's move on. What do we have here? Do you consider Medicare for All as a baseline that private coverage will build on, or will it become the only option? So let me repeat that question. Do you consider Medicare for All as a baseline that private coverage will build on, or will it become the only option? So you think you can answer that one?
Okay, so looking at Medicare for All.
Thanks, by the way, Nick, for that question.
Right, yeah, thank you, Nick. Thank you very much for the question. And maybe if there's a follow-up to it or something, so we make sure that we absolutely answer this question.
Yeah.
But in a Medicare for All bill that's there, in this situation under one single payer, you can only have one option, which is the option that is created by the Centers of Medicaid and Medicare systems, okay? That CMS is going to be building one health plan for all things medically necessary. So how Dr. Bill explained it as there'll still be the possibilities of insurance for concierge services, things that are optional or elective services. For instance, if you want a Z-Pack instead of an antibiotic pill, right? The Z-Pack might not be something that's covered, but you'll get your antibiotics. Those things are important to remember. So in a way, Medicare would be the only option for the medical necessity stuff. Anything outside of that, the private insurances can go into.
Okay, so, because I know under Bernie Sanders' plan, he wants to get rid of private insurance completely.
See, that's a myth too.
Okay, so he does.
That's a myth too.
Okay,
because the bill itself.
Yeah.
The bill itself does not get rid of private insurance.
Under Bernie's plan.
Under Bernie's plan.
Okay.
What it does say, though, is the private insurance, you're not going to gouge these folks, so we're not going to allow you to provide the medical necessary services, because this is how it has to be done, that the medical necessary services will be paid for by Medicare, not by the private parties.
So if people don't like the government plan, they can always continue with their own medical plan that they already have?
No.
Okay,
no.
So they're not going to do that.
With their own plan. They can add on to their plans that they are getting, right? But they will be they can add on to it.
Okay.
So Medicare, in a sense, it's one of those tricky questions there that takes a long conversation to fully understand.
Okay.
And that's why I say, folks, if you can, read the bill and read what it does and chime in to folks like Dr. Bill, Progressive Democrats of America, as they are fighting for Medicare for all. Chime in, give all, ask questions, put in your 2 cents there. We all need it. But the truth is, in this one, the reason why you saw presidential candidates not raise their hand is because they're playing vocabulary.
Yeah.
Right? And the truth is, you're not getting rid of private plans, but you are making Medicare the option and the only option for the medical necessity stuff. And that's the only way we're going to be able to be transparent and be able to control the prices to keep it lower, to be able to lower the prices for pharmaceuticals,
Yeah.
to lower the prices of the care that we're getting so that private industry doesn't get to gouge us, right? And the government will be completely transparent on that.
And I know that, and this, I'm going to actually give this to both of you. So the big fear is money. Okay, that's the big thing. And I know that there's a lot of numbers floating, 3-5 trillion of the cost that this is going to cost. Real quick, let's talk about cost and how you think that this can get paid for, or is this something that's attainable within what we have now? Do we have to add taxes? What do you think? 'Cause I know this is a big.
We'll go to costs.
Okay.
And this is getting a little bit into the weeds. I know, Dr. Bill, we've talked about this. And when I get into the costs, I get into the weeds, I might get a little confusing. And so it's a deeper conversation. But it's going to get cheaper. Okay. Americans pay about, in 2017, $3.5 trillion, right, for healthcare. That's how much Americans paid out of their pocket. That's what we have to be concerned about, right? How much are we paying?
Yeah.
So when you look at this, 3.5 trillion, it costs about $11,000 a year per person.
Okay.
That's more than the 317 million folks that we had here in America in 2017. So we are taking care of everybody in the most expensive way and weeding out people's ability to actually live a healthy life.
Right.
So it is 100% cheaper if we're able to get Medicare for all bill. Okay? That's the issue here that people need to realize. It's cheaper when it's done under Medicare for all.
And everybody is collectively.
Right. There's many examples, and Dr. Bill's going to come up with some right now. We've talked about it. But if you just look at the absolute numbers, it's cheaper.
Yeah.
It's cheaper to cover everybody. Yeah.
So, Dr. Bill, this is you.
Yeah, Bobby is absolutely right. And, again, I'm so glad you're running for office because you get this, okay? And I would say most office holders do. I'm sure Devin Nunes gets this too. He's just not willing to go out and in front, be a leader. So that's the ironic thing, as you mentioned, our office holders are often not leaders, they're followers. And in Devin's case, he's following the money. But, the reason it's cheaper, it costs less. And every scientific study, every fiscal analysis, feasibility study that's been done on this issue proves it over and over again for decades now that it costs less, not more. And the reason is that you are eliminating waste, fraud, and abuse. So incredible waste by big insurance, where you have all of these different insurances and doctors and hospitals, have to process these claims. They have to send in claims and they get denied, and insurance companies, over and over again. It's an incredible waste of resources. I mean, you have, one person in Canada doing the billing for an entire hospital that here it could take 10 or 20 or 100 people to do that billing for a hospital. Okay, it's simplified, it's standardized. That should ring true with, fiscal conservatives, right? Simplify the system, it's going to cost you less. But it's also fraud and abuse, and that's where especially you come into big pharma. But insurance even is fraud and abuse because they're negotiating behind closed doors. As Bobby says, we need to make it all transparent. We need to see what these charges are at different hospitals. If there's some cost adjustments based on region, that's fine. That actually Medicare does that now. So a hospital stay in, Visalia, is very different than a hospital stay in Newport Beach. Okay, so that's happening right now as we speak. in the public venue, which is Medicare and Medicaid, that already happens. It absolutely does not happen with insurance, but it's also abuse because insurance companies depend on people to not understand the billing that's going on. They depend on people to more often pay, even if they have to go to collection agencies, and that means people die. And big pharma is even worse, of course. So big pharma operates now like the mafia, where they say, "What's your life worth to you?" And give us that money, right? It's your money or your life, as opposed to, like, say, what does it cost them to produce the product and distribute the product? So antibiotics, the EpiPen, chemotherapy drugs, they're not pricing them anymore based on what it costs them to produce and distribute it. They're pricing it based on what it's worth to you, and that's outrageous because it's extortion. They're extracting money out of people. So we can take that over. We need to take control of that situation. It's going to end up costing a whole lot less once we do, and that's why we have to move to a single payer system to eliminate that complexity that's out there. And then if it's non-essential medical services, sure, those things are in the Bernie Sanders bill and the bill in the House right now, that they can have insurances related to elective things like what floor of the hospital your room is going to be, or say cosmetic surgery. That's the other thing.
Yeah.
Yep.
But it will cost less, not more, and you'll get many more benefits. And it's not your health insurance that people like; it's their doctors and their hospitals.
Right.
And you'll be able to keep that and then some. You could even
Dr. Bill, I'm going to
expand
interrupt you real
somewhere
quick.
else.
Repeat
Yeah,
what
sorry.
you just said, because that's on point. The very last thing you just said. It's not the insurance. What did you say?
Nobody likes their insurance company. Nobody
They like
does.
their.
What they like is their doctors and
That's
their
it.
hospitals and
That's-
nurses. And they want to be able to go to the ones that they've heard that have earned a reputation for giving excellent care, not based on some network or some bogus financial product that somebody sold
That's the
them
sell
through
point.
their employer. So that's why it's got to be in our hands, not in a corporate boardroom.
Yep.
Really good, really good. I like that. It's not the insurance. It's the doctors and the nurses and yes, excellent. Thank you, doctor. Okay, so let's get on with another question. Will Medicare for all cover mental health?
Absolutely. Absolutely. Medicare for all, and I believe in almost all the bills, actually do cover mental health. They cover your primary care. They cover your outpatient, your inpatient. And it will cover mental health. It'll cover, in this newest bill, I think the last two, covers long-term care as well. These are all things that are necessary to live a healthy life. These are all things that people need to know that they can have in order to do what they do every single day. Right? It's unfair that someone has to think they have to come out of their pocket to take care of an emergency where you were airlifted to the hospital. In my life that's happened, not for me, but for my children. And that emergency was an $80,000 bill. $80,000 for that.
Yeah.
We can't allow that to happen. So under Medicare for all, it's going to include all of these things that are necessary. And if you look at Medicare and you look at Medicaid, or in California what we call Medi-Cal, you'll see a lot of these services of what we already determined what is medically necessary, and you'll be able to see what those are. And that's the basis of minimal standards of what Medicare would be able to cover.
And I'm going to bring a quick story here, a personal thing that happened to me in the when I was active duty military. Active military has some form of universal health within the military. And when I joined, I had got out of the service, joined back in, and when I joined back in, my wife, they had to do physicals as well. So when they did her physical, they found out that she had a form of cervical cancer. The health care that we got, I was stationed at Tripler, or at Schofield in Hawaii. The health care there was phenomenal, excellent health care. The military health care system is absolutely incredible for me personally, and I dealt with it with my wife. And to keep her alive for 18 months, they kept her alive for 18 months. They had to contract it out because we had to get what's called a compassionate reassignment. So we got reassigned here to California. And here in California, they had to contract it out. They contracted her services out because naturally they couldn't do it. It cost them $100,000 a month to keep her alive, $1.8 million to keep her alive. And the only reason I knew that was because they accidentally sent me the bill so they sent the military a bill and they sent me a bill in accident, which was they weren't supposed to do. And I remember thinking, how is that even sustainable? And that's going back to the cost issue. And I'm glad Dr. Bill and you got in the weeds on that one a little bit at least. So let's go on to let's talk to Dr. Bill on this. Will Medicare for All cover mental health? Dr. Bill, would you like to get into that?
Yes, absolutely. Thank you, Steve. And Bobby, your answer is perfect. I would just add to Bobby's statement that we now have a crisis of homelessness in California, at least, if not even across the country. And I know a lot of homeless actually come to California because our weather is generally more agreeable, and will end up in California and actually end up in the emergency room for their care. So it turns out, again, the best science we have on this is that close to 50% of our homeless population, many of whom are on the streets because of medical bills, by the way, but almost 50% have either untreated mental health conditions and or alcohol and drug related conditions that are untreated. So when people say, what do we do about the homeless? I always say we need Medicare for All, because that then will treat the mental health and the drug and alcohol problems that folks, who end up on the street can regain their control of their lives again and get back to being productive members of society. So Bobby's absolutely right. We have to do. That's the only way that we can get control of this problem.
Right. One big thing is trying to learn population health management and moving software in that way. We are always now learning that we have to concentrate on social determinants of health. Homelessness is one of those determinants of how healthy you will be, right? And so when we look at healthcare and a lot of the savings that we're going to be able to get, we're going to be able to keep people healthier by looking at all the different determinants of health and then putting programs into place to be able to address those other issues, right? I mean, if your child doesn't have access to nutritious foods, to eating fresh fruits or anything like that, that's going to be something that's going to lead to health conditions later on down the line. And so as we study all of these things, we're going to be able to create better health programs for our entire society anyways. And we're doing it right now.
Yeah.
And we can do it much better under a single payer system.
So I appreciate Amanda R. for that question. I actually didn't thank her on that one. Okay, so we got another one. This is going to be our last question from the audience. So how do you plan to help millions of Americans get health care in the modern age? And this is from Kevin W.
Okay, Kevin. Thank you for the question. I mean, this is exactly how we're going to do it with Medicare for All. Medicare for All will help all the millions of Americans who don't have health care today get health care today. This is the solution. It's in the title, Medicare for All. I like the question, really. But basically, what we're doing now is trying to get everyone there. We have millions of people who don't have it now. We have over 30 million people who will lose it if the administration gets what they want, which is the removal of ACA. We're going to help everyone get the health care that they deserve, get all the health care access by working hard, advocating, and pushing forward and making sense to a lot of folks who don't understand it. Medicare for All. It's the right option. Health care is something everybody in America deserves.
Okay. Bill, would you like to answer that question?
I couldn't have said it better myself. Thank you, Bobby. I appreciate that. Perfect.
All right. So here we are. I hope we can do some more of these because these are really good. This is interesting stuff. I mean, connecting with the people, understanding what's on the people's mind, and you trying to answer it, and having our esteemed guest here, Dr. Bill, answer some of the questions. I appreciate you for coming. So Bobby, in closing here, what is the deal? How we're gonna make this? How's Bobby Bliatout, Bob Squad, gonna make this happen?
Yeah. No, I appreciate that. And, first let me say thank you to Dr. Bill for joining us today and being here to answer the questions from our viewers. And viewers, thank you very much for tuning in, asking some really good questions. I really do appreciate this. This is going to take a lot of people, a lot of folks to get together and to continue to educate everyone around you that Medicare for All is the best option that we have. That's the way that we have to move forward. That's what we have to do. I will continue pushing forward. I will continue going and doing my best to educate everybody about it. And I don't know absolutely everything, so I love the education I get from you, Dr. Bill, and anyone out there that wants to chime in. I'm always open to do so. In order for us to continue to move forward, we have to continue this fight. And it is still a grassroots thing that I think all of America really wants. Okay, they really want a single payer system, something that's economically feasible, something that takes care of everybody, right? And so what we have to do is convince our elected officials to actually stand up and be able to do it. And that has a lot to do with other issues that are political, which health doesn't care for, but this is the case. There's a lot of money influencing what's going on in Washington, D.C.
Yep.
And, bringing in another thing, I would love to end Citizens United, right? We've talked about these kinds of things before. Money in politics is what is making it dangerous for people to stand up and say Medicare for all. I've talked to people and said, Bobby, you're willing to say Medicare? Yes. And being a CEO, being an executive of nonprofits, right? Understanding how it's out there, what has to get done, and where profits don't matter as much as providing the care for people.
Yeah.
Right. You just need enough economics in there to make it run.
Make it happen.
Right. And that's what people have to realize as well. And for me, to be able to do this, I don't come from a profit-driven point. I come from a quality, humane, making sure everyone can have access to care. That was the sole purpose of creating the FQHCs that we did, was to be able to culturally, sensitively, be able to provide care to the underserved.
Yeah.
Like 90-something% of my patient population comes under CMS, the Medicare and Medicaid services, right? That's important for people to know as well. This system works. Medicare for all works, and that's what we have to continue to say to folks. And I also want to say that we're not going to be able to convince everybody in 1 hour.
Yeah.
Right. We had 1 hour today to do this. We can't answer every questions. And thank you for asking questions. We'll probably do this again. Yeah. Right. We'll do this again. Dr. Bill, I hope you'll be able to join me again as we do this and educate folks about this.
Absolutely.
Yeah, so we will do this. This is how we're going to do it, and I just want to thank everybody for participating and watching here. And Dr. Bill, I'll let you close us out. What do you?
Well, that's so kind. So, I always say that if Dr. King was alive today, he would say it's immoral to profit off of a condition of human need, and that's what's going on right now with these, especially big insurance and big pharma institutions. So what we need is Medicare for all, right? Incredibly popular idea. Medicare is economic justice, and for all is social justice. That means, without economic justice, you can't have social justice. And no justice, no peace. Thank you. Thank you, Bobby.
Awesome.
Thank you,
Awesome.
Steve. Appreciate
Thank you very much. And real quick, I just want to tell everybody that if you're out there and you still have questions, go ahead and email them to bobsquad2020@gmail. We probably could put it on the Bobby Bliatout, the Facebook page and some of your media pages. That way we can answer some of your questions. So if you have some, go ahead and send them. I'm pretty sure Bobby won't mind. I just put them on the spot.
We will do it. We will do it as well. And actually, Dr. Bill wanted to get some of his information up. KP, will be able to get that in there.
Let's
it's scrolling down at the bottom. Dr. Bill, you wanted to make sure that, there we go. So if we look at it there, Dr. Bill is ready to answer any of your questions as well from the Progressive Democrats of America stance as well. And he even put his
Someone
phone number
scrolling-
out there.
scrolling there on the
So
bottom
take a
there,
look at
so-
it. 949-246-6283. Give him a call too. He will let you know all about it. And if you want to check out Progressive Democrats of America website, it's pdaamerica.org.
There it is, right there. Well, this is great. I'm glad we got. I like this
The
kind
nerve.
of stuff.
All
I
right.
like this kind of stuff. So this is the kind of stuff we need to have for our candidates and soon to be District 22 congressional leader sitting right next to me, Bobby Bliatout.
Let's do this. Okay. Thank you very
Anyway,
much, guys.
Thanks for tuning in, everybody.
Thank you, Dr. Bill. Thank you, everybody, for tuning
Thanks,
in.
Thank
Dr.
you.
Bill.